Hello and welcome to part 3 of the Women in Concierge Medicine Podcast, brought to you by Specialdocs Consultants. I'm Terry Bauer, CEO of Specialdocs. We've gathered 5 leading female concierge physicians for a panel discussion on why the concierge model has proven to be an ideal fit for them. It's a great resource for any physician considering a transition to concierge medicine. You can find the entire series on the News and Insights page of our website, Specialdocs.com, or on any of the Specialdocs social media pages. What you're about to hear is part 3 of the podcast, where the doctors share their observations on the differences between female and male physicians. Thank you for watching. We'll move on to another topic. Since this podcast is entitled Women in Concierge Medicine, we're going to talk about the female side of things. And a couple of facts that I think you're all probably aware of. I think today, 1 in every 3 physicians is a woman. In addition, I believe that for the first time in history, new medical school students, there's a majority of female students now going into medicine. So, and there's been research that's been done that suggests that outcomes are better with patients who have a woman physician. So I'm interested from all of your perspectives if this is something that you're familiar with, if there's something that's different about the type of care that a woman provides versus a man, and then anything else that you think would be different in terms of the approach or the skills or the strengths of a woman who's a concierge physician than a man who's a concierge physician.
Well, Terry, it's an interesting question. I remember when I started practicing, I would have patients come in and they would say, I want to come to see a woman because you're going to spend more time with me. And it's not like I had any more time to spend with anybody than the guys do, but the expectation is that you're going to spend more time with patients. And I don't know if y'all also experience that. And you can't really practice that in a traditional sense. So concierge medicine is perfect because you really do. It's all about time, and it's the most precious thing we have. So you can meet their expectations when I couldn't do it before. So that's the biggest thing.
Natasha, you'd like to comment on that topic?
I will just respond to Nan and say I completely agree in terms of the timing, that probably all along I was always spending way too much time, and maybe that was a female type expectation, or maybe it was my own habits. I'm currently in practice with 1 female physician assistant and 3 male doctors. And I still spend the most time with all of my patients, even though we're all concierge. So maybe it's taste, maybe it's just the 5 of us and how we wash out. But I think it's so suited to how I was already trying to practice. So maybe there's something intrinsic about it.
Judy, you're being quiet. I'm going to ask you to comment on this.
Well, actually, Monica wanted to speak.
No, you go ahead, Judy.
You know, so I'm in a practice with 2 males, and I have to say they both spend quite a bit of time with their patients and take great care of everybody. But you're right, I still do spend a little bit more time with patients, and I think it's just that need to make sure that everybody understands exactly what we're doing and where we're going, and just that need to be so complete and make sure everybody's happy before they leave with what the plan is. So I don't know what that is, female versus male, but I do see the difference even within our concierge practices.
That concludes part 3 of the Women in Concierge Medicine Podcast. You can find the entire series on the News and Insights page of our website, Specialdocs.com, or on any of the Specialdocs social media pages. Thank you for watching.